My name is Jaap Hoogland. I'm the owner and CEO of this endoscopic company. Yesterday we were able to meet each other. I think most of you already quickly met. Welcome, thanks for coming to the 7th endoscopic course this year in Germany that we organize. Here are a few slides on what we are doing and where we come from, and then the faculty will give a few presentations, and in the afternoon in lunchtime same, and between we will do cadaver training. On the first slide you see surgeons who started to think minimal invasive to the spine, who did first publications on minimal invasive approach to the spine. Parvis Cameron on the top left, who described Cameron's triangle, and on the bottom right you see Tony Young and my father Thomas Hoogland, two spine surgeons who were pioneers in designing instruments, publishing things, and brought out the first systems for surgeons around the world. Tony Young did that with Richard Wolf, and my father started with Joymax and later on came out with the MaxMoreSpine system. He was a very busy surgeon from the Netherlands, moved to Germany, started a spine clinic, active in conferences, training, and did a lot of procedures, and that's where our first system was based on. 8 years ago, when he passed away, I took over this small company and started to design new systems with the Korean surgeons who were the first ones to adapt spine endoscopy. And with the experience of Gun Choi and others, we were able to make new systems for different endoscopic procedures. Here a little timeline. It all started in 1994, where the first cases were done. In 2000, the first system came to the market from our side then. 2006, Hoogland Spine products were started with the MaxMoreSpine systems. 2015, I joined the company. 2018, we opened the office in Frankfurt. And last year, we opened the office in Netherlands and USA. A little timeline on different registrations around the world, different systems that we made. Here you see the structure, meanwhile, of the company. Teams in Munich, Frankfurt, USA, and Netherlands. And meanwhile, also representation in most countries around the world, but not everywhere. I think in the next years we will have...
You missed Iraq.
I missed Iraq.
And Croatia.
Oh, yeah, it goes fast. I need to update the slides. But yeah, as you see, we're not everywhere, but we're getting there. I estimated a bit to get a feeling about the volume, but in the last 15 years, I think 500 centers around the world probably started with MaxMoreSpine. A lot of it is also in China. China had a big wave of endoscopy. And I think around this year, about 50 hospitals will start of people we train, but it's still a small volume of spine surgeons doing this. And it's growing, getting more and more attention. Here's a slide where also a lot of surgeons are missing, but these are surgeons who help us with trainings, who did publications about MaxMoreSpine, who bring in new ideas. Just to give you an example, all over the world there are surgeons who are doing this and doing this with us. So what are we doing? What is this company busy with? We are designing and making instruments for endoscopic spine surgery. The tools you see there on the table that you will play with today, trying to make them better, try to make them stronger, try to make them easier to handle. That's our daily business. That's what we are focused on. One of the important instruments is the endoscope. It's also the most expensive instrument. We put a lot of focus in that, and a couple of years ago we have a new way of making them. They're engineered with gold-luted lenses. And this gives it a longer lifetime, which is very important. It's resistant for autoclave, and now we see that the scopes don't last forever because surgeons use electric drills, use big instruments. They get damaged. It's still not perfect, but at least the sterilization process issues are more or less solved, and there was a big step for us to give a better quality. The design of the instrument, I think if you look at endoscopic systems, it always looks the same. You see an endoscope, you see some sleeves, you see some tools. If you look at us or different companies, pretty similar. But if you take a close look, the instruments are never really the same. And it's always for a reason. So the size, the shape, let's say a millimeter in doesn't look much, but if you work in the spinal canal, it's a lot. So that's to every instrument there's a story, and I think we did a very good job putting the experience of these surgeons into these instruments. The different kind of forceps garrisons, we were able to make them stronger, give more grip, just by details and just by continuing this process of redesigning and improving. The endoscopes are connected to endoscopic tower. From our company, what's special is that we have an open platform. It works with any endoscopic tower that's available in the hospital. We try to make these procedures accessible for everybody. That's our policy. And we find some solutions to, if there's need for that, you'll see that today. This is an all-in-one camera, light source, screen option, and very portable, and then the full endoscopic tower. Last year we came out with our own radio frequency, an important tool for your procedures to stop bleeding, to clean, and the tool you will use in every surgery, now also with MaxMoreSpine. Here you see the different indications for spine endoscopy. It all started with disc herniations. Afterwards, stenosis. We have a system for intradiscal, facet joint, SI joint, and now what you see that experienced surgeons, our faculties can talk about it, field back surgery and endoscopic fusion is starting to be a new trend. To place cages, to clean the disc, use an endoscope, combine it with your fusion surgery. This slide shows the different systems we made over the years. It started with the transfemoral system, interlaminar anterior cervical system, intradiscal, joint ablation, biportal, and finally the fusion system that will come out end of the year or beginning of next year. And you see with each system you can do different kind of procedures. Today we will look at transfemoral and interlaminar, but if you are interested in the other things, of course we can show and we can look at it as well. This is again a slide on the different systems. I think the MaxMore name comes from more. You can do more with one system than what the other systems do, and it's quite a lot. So with one endoscopic system, you can do the interlaminar. You can go interlaminar as well. You can go to the disc, intradiscal. You could do endoscopic fusion with our tools. Just a wide range of indications, and same with our interlaminar system. So we designed the scope in a certain way that you can treat stenosis, disc herniations. You can use it for cervical cases, and also treating SI joint and facet joint. A small scope for anterior endoscopic procedures. It's not widely adapted. It's a difficult technique, but we have it in our portfolio. And designed by Dr. Guncho, who did over 3,000 cases. So again, based on a lot of experience on cervical surgery. This is Dr. Feldman, a pain physician from the United States. He wanted to have a system to do intradiscal for bulging ruptured disc. United States is very popular, in the rest of the world not that much. This is the system for our facet joint, where we use the same endoscope for interlaminar. A new concept. Most of you don't treat facet joint pain, but if you do, it's interesting. What we do is we go directly to the capsule, do a denervation on the capsule, and it preserves the nerves from growing back. So it's an effective and easy procedure to start with. And the latest system we came out this year is biportal. It's a new trend. It's not really new. Dr. DJ Choi is doing this for over 10 years. Again, all the experiences put into these instruments. And now we see people in Europe starting to do biportal surgery. And we are the first company who have a system released in the international market with CE and FDA. This is the last thing we are working on. Already we did 50 cases with Dr. Morgenstern, putting in rather big cages to Camden's triangle, where we have special instruments to open the foramen, to safely put these cages inside and protect the nerve. Results are very, very promising, and next year we can do this with everybody. Here's a slide on the literature. Over the years, there's been many publications on spine endoscopy, and this one is the most important one. Came out 1.5 years ago in a British Medical Journal. It was a study done in the Netherlands, financed by the Dutch government, Ministry of Health, and initiated by Dr. Harangi, who's here today with us, to prove that spine endoscopy is as good or better than microdiscectomy and transfemoral approach, and they were able to prove that. So the Dutch government accepted this. It's now paid in the Netherlands in the national healthcare, and we also see that outside of the Netherlands, people are taking this study to justify what they are doing. I think for the other procedures, there still needs to be more data and more publications, but for transfemoral surgery, there's a study with level evidence 2 showing that it's cost effective and has advantages for the patients. The endoscopic procedures, it's not buying a set and doing it. It takes a lot of training, and that's what we are here for today, but also what we are here for after the training. We try to help you to get the confidence to do it on your own, and together with your local partners, we organize not only cadaver trainings, but also online courses. We have places where you can visit. We can send a surgeon to do the cases. So think about it, how you want to start your endoscopic career, and we are there to help you with everything you need. There are possibilities to go and see surgeons, to be there for a day or for a week or for a year. Here are a few examples with surgeons and centers we work with. I recommend you to take the time and go and see it. It will help you through the learning curve. What is different from MaxMoreSpine? I think we are very close with the surgeons still. It was founded by a surgeon, and we're always busy in making new developments, trying to improve the instruments, and focus on spine endoscopy instrumentation. That's where we are good at. Now I want to take the last slide to introduce the faculty today. We have Dr. Ghazwan from Iraq, pioneer who started 5 years ago with spine endoscopy, and now takes the lead in the Middle East on spine endoscopy with training, and very nice to have you here. Thanks for coming. Dr. Musa from Nigeria. Thank you for coming, Dr. Musa. It's a remarkable story. Always proud to have you here, and you will tell yourself, hopefully, in your presentations. Every day he does endoscopic surgery with MaxMore, and thousands of patients, meanwhile, have been operated by him. Thanks for coming. Then Sanjay Harangi, I already mentioned him, study initiated in the Netherlands. When I started 8 years ago with MaxMoreSpine, he was one of the first surgeons who stepped up and helped me. So he's doing it for over 8 years, probably 10, 11 years already doing spine endoscopy, if not longer. Big support always with the trainings. Thank you for coming and helping. And last speaker here today is Dr. Hura, professor in Croatia and spine surgery, endoscopic spine surgery, also for probably 8, 9 years, doing endoscopic surgery every second day. Very good teacher. Thank you also for being here, and I'm going to give you the stage, Carlo.